equipments today. First one is diagnostic equipments. This is first one. This equipment is blood pressure monitoring equipment, which is called sphygmomanometer. Sphygmomanometer. Okay, it measures the blood pressure of the body. This is called stethoscope, which listens to heart, lungs, and other internal sound. You would have definitely heard, seen doctor checking it for you during fever or cold cough, right? So he checks the lungs, how much cough or cold is there in the lungs. This is a thermometer. There are three types of thermometers. So first one is digital, infrared, and mercury. There are three types of thermometers. And this measures the body temperature. Our normal body temperature is 98°F. So digital is normally kept in our households, right? You would have seen it. Here is a digital one. It shows the numbers here. Okay. You keep it in under your arms or tongue. It is usually kept under any of the skin. Infrared thermometer. Here is the infrared rays which goes to our skin. You would have seen during COVID-19 times in a malls or something, they used to check the fever of the patients, fever of the customers, whoever are coming there. And here they used to see the digital numbers. Mercury thermometer is usually present at the hospital. Here the mercury moves up and shows the temperature of the body. How much heat it is usually measured during our fevers, right? This is called otoscope. What is it? Otoscope. It examines the ear. How does it examine the ear? Doctor usually put this in the ear to check the infection or the wax if it is more. I'll show you. Yes, something like this. Doctor checks it, right? If you have a ear pain, your doctor pediatrician checks it. This is ophthalmoscope. Ophthalmoscope. Ophtha word comes from eye. Ophthalmologist is the doctor who checks the eye. So ophthalmoscope is this one which examines the eyes. Okay, like this. Okay, he checks our eyes, how much vision is there, how much we can see, if we are having any power, or if there is an infection. Okay, this is an X-ray machine. Okay, patient is slept here, and whatever part he wants to scan, doctor will put this machine here and scan it. So, what is an X-ray machine? It has an ability to penetrate the matter and reveal the internal structure. Penetrate in the sense the light which comes from the X-ray machine goes inside the body or inside whatever is an object present there, and it reveals what is inside that. Where and all it is used, let's see. It gives an image of the fracture or any internal conditions. Tumors, infection. Tumor are the cells which is joined together to form a small ball like structure inside our body, which causes a lot of pain. So to check if cells are separate or if it is joined together, then this X-ray machine can help us. Or if a fracture of the bones. Where else it is used? It is used in radiation therapy to destroy these tumor cells, also called as cancer cells. It is also used in crystallography to check the atomic or molecular structure of the crystals. It is also used in security checks in airport malls. Have you seen the security checking it for you and the bag that passes through a machine when you go the mall, airports, uh, metro stations? Okay, you undergo a security check. So what is the security checking with that machine? It is an X-ray which is coming, X-ray rays which are coming, and that will reveal if you are having any criminal things inside your body or inside your bag. It will reveal it to them, say bullets or something like that. If you're carrying, it will locate the bullet. And in astronomy, it will detect the black hole sorry, black hole. Okay, it will detect the black hole, neutron stars, supernovae, all that. It also detect the pearls in the oyster, pearls, moti that comes out of the oyster under the sea. So it also detect, x-ray also detect if there is a pearls inside that oyster. Okay, so there's a huge uses of x-ray, right? Not only in medical, apart from medical also it is used in security check, in astronomy, in pearls, okay, whatnot. Wow. So next, let us see MRI scanner. This is called MRI scanning machine. Person is slept here and he or she goes inside and the checking happens. What is the full form of MRI? Magnetic resonance imaging. It is a detailed imaging of an organ, tissue, or structures inside our body. It uses a strong magnetic field, radio waves, and computer technology to create cross section and 3D images without exposing patients to, yeah, sorry, without exposing patients to ionizing radiation like CT scan or X-ray. X-rays are something that rays come out of the machine. In this, there are no rays coming out of the machine, so patient is safe. It only uses a magnetic field, North Pole ripples, North and South Pole, like poles ripple, unlike poles attract. We have read all that, right? So it uses the technology and radio waves and also the computer machines inside to process and give the cross section view. What is cross section view? When you cut an apple and you see the image inside the apple, similarly, here also it provides a cross section view, 3D image of an organ. Okay, it is widely used to examine brain, spinal cord, joints, heart, blood vessel, other organs. It helps in diagnosing conditions such as tumors, injuries, neurological disorder, and cardiovascular problem. Neurological disorder is related to brain. Tumors is nothing but cancer, I just told you, and any other injuries of the organs, or cardiovascular problem. Cardiovascular problem is nothing but a heart disease. Okay, the word cardio is related to heart. Cardiologist is an expert doctor treating heart. So cardiovascular problems. Okay. Hope you're clear with MRI scanning. You should know little bit of it. You should, after seeing the machine, you should be able to tell that it is what it is, whether it is X-ray or MRI scanning, like that. So that is all is questions mostly asked. So you should also know the details what it does. Okay. So these are the type of questions that would be asked in the Olympiad. So this is how the person goes inside for MRI scanning. This is CT scanner. CT stands for computed tomography. Uses X-ray. Multiple X-rays are taken from different angles, okay, to create a cross-sectional or a slice of body's internal structure. I just explained you the cross-section view, right? Slice of an apple, similarly slice of an body's internal structure, or an cross-section view of bones, organs, soft tissues for any injuries. Okay, how it works? Here, multiple X-rays are taken from different angles to create the 3D image of the particular part. Okay, this is called a CT scanner. Multiple X-ray is CT scanner. MRI is magnetic resonance. So there is only a magnetic field and no X-rays. Magnetic field and radio waves there. Next is ultrasound machine. Ultrasound machine is something like this. It also gives the image of soft tissue and organs, creates image inside of the bodies by sending high frequency sound waves into the tissue and converting the returning echo into real time visual images. So what are these? It is nothing but it uses a sound wave technology. High frequency sound is sent inside our tissues and organs, and the echo that returns. Okay, there's an echo that returns. The computer uses that returning echo to processes that returning echo and gives the visual image in the computer monitor here. Okay, it completely uses a sound technology. Ultrasound machine, it uses a sound technology. Okay, next is blood analyzer. Like this, it measures the body components, blood components, sorry. It measures the blood components like glucose, cholesterol, complete blood count. What is complete blood count? White blood cell, WBC, RBC, all this is are the cell which is present in the blood. White blood cell, WBC, red blood cells, RBC, hemoglobins, platelets, blood gases. What are the gases that are present in the blood? So these different things of the blood are measured in blood analyzer. So what is a machine used by diabetic patient to check his glucose level, or an heart patient to check a cholesterol level? Okay, heart patient also check cholesterol, normal people also check cholesterol. So glucose is nothing but diabetic patient check when his glucose is, insulin is high or less in the body. Then this blood analyzer is useful for a diabetic patient. Okay, next we'll see what is this. Yes, you all know it. It is a microscope. What does it do? It examines here. Here is a small lens here, and here they see it. Eyes are kept here, and here are the cameras, wherein here a slide of small plate of bacteria or whatever is the sample is kept here, and through the eyes here people watch it, what is in the zooming way. Okay, here you can 50x, 100x, 200x it times. It zooms and shows you how the tissue or bacteria or parasites, microbes present in this sample whatever we keep. Okay, next is PCR machine. What is PCR? PCR full form is polymerase chain reaction. Polymerase chain reaction. It has a thermal cycle which amplifies DNA by cycling samples through precise temperature between 4 degree and 99 degree, using programmable heating and cooling blocks. Okay, so don't get confused. It only heats a more high, very high temperature at 99 degree, or it chills very much at 4 degree. So continues alternative heating and cooling the blocks. By that way it examines the tissues, bacteria or parasites present. Where is it used? It is used in forensic science to match the DNA. Okay, where any criminals shoot and go, or they do the theft, or they do any crime in the crime scenes, when they touch any place, handles, or they leave the kerchief, handkerchief, or their hair falls. By that, they check the DNA using this polymerase PCR machine, polymerase chain reaction, to check if this is a thief. If this is a thief, if they find out the hair, then they will check if this is a person who has done the crime. Okay, like that it is checked in forensic science. Then genetic research, paternity test to check if this is a mother, to this is a father, to check, to cross check. Paternity testing, this is the father of the child, to check that. Medical diagnosis like COVID-19. Yes, during COVID-19 also PCR machines were used commonly. But how? From nasal swabs, they used to put a small pin like thing in the nasal cavity, nose, inside the nasal, and take out a small fluid to check the infected cells from the nasal drops. Okay, yeah, if there is any infection, COVID infection through this nasal, how did they do that? To through this PCR test only. Okay, so all these were the diagnostic equipments. Equipment, sorry. Okay, next let us go to surgical equipments. When the surgery happens inside the hospital or somewhere, so First one is scalpel. It is a small instrument which is used for precise cutting during the surgery. I would like to show you that. Yes, this is the small blade like structure which is called scalpel. It is used for precise cutting of the, yes, precise cutting during the surgery. Next, there is something called as forceps. Like this is called forceps. Why is it used? It is used in grasping or holding tissues for firm and sustained gripping. Okay, it is used in delicate procedures requiring fine control such as plastic surgery, dermatologist, ophthalmologist, and microsurgery, where very delicate organs are included, like skin. That's where they do the plastic surgery. Dermatologist means anything teeth part, gums, teeth are involved. Ophthalmologist, uh, eyes. Sorry, dermatologist is nothing but the skin related, and microsurgery, where all these are involved, forceps are used. This is surgical scissors. It is used for cutting tissues or sutures. Okay, something like this. Okay, next is sutures. These are nothing but the specialized threads or a stands used to stitch the tissues together during the injury or the surgery. It is used for closing the wounds also. Okay, sutures. It is just a thread or a strand. Tweezers. Okay, tweezers is like forceps only. Okay, used in delicate procedures to control. Okay, next is electrosurgical pencil. It is also called as cautery pencil or Bowie. Okay, it is a pencil like this. Okay. Hmm. So it is an handheld surgical instrument. So all these we are seeing are the surgical equipments used during the surgery for cutting tissues, coagulate blood vessels, and control bleeding. It delivers high frequency electrical energy. It through this electrical energy comes to target the tissues. Next is surgical blade, which is a sharp instrument again to cut tissue during the surgical procedure. It comes in different size and shapes. Okay, surgical needle. We saw surgical sutures, and this is surgical needle here. It comes in curve shape or a straight shape. It is designed to place sutures in tissues with minimal trauma. Minimal trauma, minimal damage, or minimal mental stress to the patient. Surgical stapler. It is like our normal stapler, right? It is also a surgical instrument used to close the wounds or connect tissues. It is alternative to the surgical needle and sutures. Okay, this is a minimal pain which it gives to the patient than the needle. Now, surgical stapler remover, something like this. After the wounds are healed, during the wounds or surgery, doctor may put the stapler. And when it is healed, the stapler pins has to be removed. So, how will it be removed? With this surgical stapler remover. It efficiently extract the stapler from the healed wounds after the wound is healed. This is also causing the minimum trauma to the patient. Next is surgical light, something like this. Above the surgical table, it would be. It focuses light on the uh, surgeries to the patient. It is bright and shadow free illumination. This light does not give any shadow of the hands or doctors, so that they view the bright, clear uh, part of the operation during the surgery operative side, enhancing the visibility and safety during the operation. Surgical table and chairs. This is a surgical table. It provides stability during the operation. It is also flexible and precise adjustment. However, doctor wants, he can adjust it. He can move little up, down. However, doctor is comfortable during the operation. This bed can be moved up, down, or just the header part can be moved up or down, or the leg part, like that. Okay, it even support patients during the surgery. It is a monitor where all the readings are shown from different instruments. Okay, this is an oxygen mask. Note, this is a surgical mask where doctor puts, and this is an oxygen mask. Here, the small one you can see, this is an oxygen mask. This is a surgical mask. Oxygen mask is for patient. Surgical mask is for doctors. The oxygen mask provide and supplement oxygen, means an additional oxygen to the patient who cannot maintain the sufficient oxygen level during the breathing. Surgical mask, it is for the doctors and nurses, whoever are present during the surgery. Okay, so that they don't get the infection. It prevent the spread of infection, create a barrier that reduces the exposure to respiratory droplets and other contamination. Used in dental procedures, isolation wards, laboratory, medical procedure during the surgeries. Okay, next, these are the rubber gloves. Exposure to pathogens, chemicals, and bodily fluids. It prevents them. It is used during surgery, chemotherapy treatment. Chemotherapy treatment is for cancer cells, chemo cells, or cancer cells, prevents that. It is used in examination, laboratory, many places you would have seen wearing, doctors, nurses wearing this. Okay, what is the material that is used? You should lightly know about this material also. Latex, nitrile, vinyl, polycoloprene gloves. So these are different types of material. When they say these material are used in what, gloves, scrub, mask, options like this, so you should know latex, nitrile, vinyl are these rubber materials, okay, which are not natural. It is used in rubber gloves. Scrubs, okay, these are the scrubs that are worn by doctors. This is also a protective barrier to prevent infections. Made of fabric that can withstand very high temperature during laundering. Means when it is washed, even very high temperature, nothing will happen to this fabric. Why very high temperature is required? So that any bacteria, microbes which is present in this scrub, it can be removed during the washing at very high temperature. All these microbes like bacteria, virus, pathogen, harmful things are killed during that laundering. So they were the traditional fabrics. Now the modern scrubs have antimicrobial fabrics. Antimicrobial means such a fabric where all these microbes does not get attracted, they are thrown away by the fabric itself. Okay, what are those material like? Silver nanoparticle coating or bamboo rayon. Silver nanoparticle coating or bamboo rayon are the modern day scrubs, so that it does not attract microbes. Still, the high temperature laundering is required because these can reduce the bacterial contamination, not eliminate it completely. Next is therapeutic equipments. This is infusion pump like this. Okay, this is called infusion pump. It delivers fluid, medication, and nutrients to the patient. Next is dialysis machine like this, and it is connected to the patient. Dialysis machine, when kidney of a patient is failed, what kidney does? It filters the blood, and the waste from the blood, like urine and all, is removed, correct? So when kidney is failed, when one kidney is failed, another can work. When both the kidney are failed, what does patient do for passing the urine? Then this dialysis machine helps him or her to filter the blood. It is filter blood for kidney failure patient, removes waste like urea or creatine and excess fluid from the blood. It also balances electrolytes such as sodium, potassium, calcium, and bicarbonate. Next, this is nebulizer. You can see here there is a mask which is put, and this is a nebulizer machine. It is used when patient is not able to inhale, breathe properly. So here are the medication which would be put, and it goes through the mask which is put in the nose of the nostril, nose place of the patient. So it delivers the inhaled medication directly into the lungs. So through the nose it goes to the lungs. Used for asthma. Asthma are patients who are not able to breathe during certain conditions, like breathing, like walking too much, or walking high like hills and all, trekking. They are not able to breathe. So those asthma people, these are used. Bronchitis, pneumonia, and other respiratory infections, nebulizer is used. Okay, let us now move to monitoring device. Before that, do you want me to revise it once again? Let's see. Diagnostic equipments, what are these? Spigemanometer, it diagnoses blood pressure. Stethoscope, thermometer, there are three types of thermometer: digital, infrared, and mercury, which measures the body temperature. This is otoscope, it examines the ears. Ophthalmoscope, which examines the eye. This is x-ray machine, penetrate into the internal matters and gives the internal structures. This is MRI scanning. Okay, it gives a cross sectional and 3D image using the magnetic field. This is CT scanning, computed tomography. Okay, this also gives a cross-sectional view and 3D image, but using the X-rays, multiple X-rays from different angles. Okay, this is an ultrasound machine, uses the sound of the internal body, and get when the returning echo comes, the computer processes and gives the visual image, real-time visual images. This is ultrasound machine. Blood analyzer, this next is blood analyzer, which gives the blood count, glucose, cholesterol, everything present in the blood. It gives the detailed report of the blood. This is a microscope which examines the bacteria, pathogen samples in the tissues in the sample. PCR machine, where DNA samples are put and DNA match of a criminal or a parent can be done through this. Even the DNA match of COVID, during COVID, the coronavirus was being also tested through this. Okay, so these were the diagnostic instrument. Surgical instrument we saw: scalpel, forceps, surgical scissors. Sutures are the needles, tweezers, electrosurgical pencil or cautery pencil or bowie, surgical blade, surgical needle, surgical stapler and surgical stapler remover, surgical lights, surgical tables and chair, monitors, oxygen mask for patients, surgical mask for doctors and nurses present there, helpers, rubber gloves, scrubs. We saw the surgical instrument. Okay. Next is therapeutic equipments, infusion pump, dialysis machine used for kidney patient. Infusion pump, it delivers fluid, medication, and nutrients to the patient. Dialysis machine for the kidney failure patient, which filters the blood and removes the waste from the body. Nebulizer for nose, medications are directly put to the lungs through nose using this mask, and the fluid medications are put inside this nebulizer. Next, let us move to monitoring devices. These are monitoring devices. First one is ECG machine. What is ECG? Electrocardiogram. Okay, full form is electrocardiogram machine. What does cardiologist? Cardiologist is a doctor. Cardio is a word related to heart doctor. So, yes, electrocardiogram records the heart electrical activity, okay, to detect any heart attacks in future or other cardiac condition. It sees any blockages in the arteries, veins, in the heart somewhere there are blockages. It checks all that and gives it like this. So all these wires are used from a machine like this. It put there and it detects the heartbeats. Okay, electrical activity of the heart. It is given in the graph. The printout is given in graph like this. It is a very detailed printout, so doctors can check and give that. Pulse oximeter. Here, this finger is put, one of the finger is put inside this pulse oximeter to give the blood oxygen level, how much pulse. It detect the pulse and gives the blood oxygen levels. And this is a medical scale. It measures the body weight. Okay, let us move to life supporting device. When there is difficulty level, critical level of a patient, then a ventilator is used wherein it assists and control in breathing. And when patient is not able to breathe, so this is a ventilator machine. And here is a, okay, mask is given here, ventilator, through ventilator it is. Next, defibrillator. It restores the heart rhythm with electrical shock. Yes, electrical shock is given to the patient so that it restores the heartbeat and patient is able to breathe properly. Next is oxygen cylinder. These are the big, big cylinders you would have seen. Long, tall cylinders of oxygen. It provides a supplemental oxygen. These was very widely used during COVID time when one of the symptoms of COVID patient was uneasy breathing. So high oxygen cylinders were being required that time, and due to its insufficient supply, many patients were even died. So it is very important. We should always thank God for giving us oxygen all the time, and He's not charging us anything, right? But when we go there during COVID, 1 lakh was charged for these oxygen cylinders. Yes, so we should always be thankful to God for providing us oxygen. And next is mobility and support equipment. These are the hospital beds. Mobility means which can be movable. Is anything that is movable is called mobility. So here it has a wheel. Patient is sleeping here. So these are also adjustable bed for patient. It gives mobility, so it can be he can be shifted from operation ward to normal ward to any other checking ward, diagnostic lab or something like that, treatment lab, all that he can be moved. When he's not able to walk himself, he can sleep here and this bed can be moved with the supporting devices connected. Now, wheelchair. Okay, these are the wheelchair you would have seen. It is used for the mobility aid of the patient to help in the mobility movement of the patient when he is not able to walk. Okay, you would have seen in airport, malls, other places where patient is not well. And this is walker, where the old people catch this and walk. This particular thing is called walker. Okay, yes. Even the babies use walker, a small one, when he's learning to walk. Few months old, maybe 7, 8, 9, 10 months old to 1 year, they use walker. Similarly, this walker is for elders when they are not able to. Elders, or even when they are having any bone fracture, bone in the leg, then they use this to walk slowly. Okay, you can see a small wheel also here. Next is laboratory and testing equipments. When we go to lab and just for the testing, okay, yearly once you would have seen your parents or grandparents going and going for a checkup. So, what are things that are present in the lab? Next time when your parents or grandparents go, do visit lab and check all these instruments there. Okay, these are the centrifuge. There are different type of centrifuge where a small test tube is kept and moved, and through the spinning the liquid is separated. How the liquid is separated? Based on size, shape, or the density. Density is the thickness of the liquid. So based on those things, spinning is round. You would have seen how the washing machine spins round and round and round. So here this round happens. This is called centrifuge. It is kept for some 5 minutes, 10 minutes, or half an hour, and the liquid separates up, down, different ways here. And by that, they separate the liquid and do the testing. This is test tube rack, wherein they hold the test tube, fill test tube here straight inside the hole, empty test tube here upside down, ulta way. Okay, in each of these standing lines, test tubes are kept to organize the test tube in a test tube racks. Dropper, you would have seen this dropper in the your medicines also, right? To take the medical syrups. Okay, it applies liquid in small amount. It takes liquid in small amount in few mls. This is called pipette. It takes liquid here. What does pipette do? It accurately measures, transfers, and dispense liquid in small volume of liquid. When few milligram liquid is required in the lab to take it for the testing, then they put those small milligrams here and press this button, and only that much milligram liquid, ml, not milligram, milliliter liquid is taken in this, and they put it in the testing piece and they test it. So it accurately measures, transfers, dispenses is throwing out the liquid, very small amount of liquid through this pipette. Syringe and needle. This is a syringe and needle. Of course, you know it. You would have had it many times, right? Has an injection. It injects or draws fluid. It also gives an injection. So it injects any liquid into our body, or the same injection, the syringe is also used to draw the blood from the body for testing. Yeah, usually our grandparents go in the lab, they take this syringe and pull out some blood for the diabetes blood test, right? So that is required. This is used for that purpose. This is just few other things. If they show it like this and show what is it, this is called a blood bag wherein blood is collected. This is an antiseptic liquid, bandage, or a braces. The teeth, it is called the silver one. They put the to align the teeth in the order are braces. So we have already revised now up to half. Next half, life supporting. This is a ventilator. This is defibrillator, oxygen cylinder, mobility and support equipment. This is hospital bed, wheelchair, walker, laboratory testing equipment. These are different type of centrifuge. So any of the one photo can be given and asked what is this called, X-ray machine, centrifuge, or different things like that. Okay, blood analyzer. So what will you put? You would always take it as a centrifuge. Okay, this is a test tube rack, dropper, pipette, syringe and needle. Syringe. Okay, so hope you enjoyed reading this, knowing this. It helps you. Do subscribe the channel so you would get the notification of similar videos when I keep posting. Okay, bye bye.